Good morning everyone. Today I will present about the radiograph journal, but first let me introduce myself. My name is Fakika Mauludin Isnain, the fourth student of radiology engineering from class 1C. So the radiograph journal that I want to present to you is about the role of imaging in examining neurological disorder, assessing brain, stroke, and neurological disorder using CT and MRI imaging. In the healthcare system, the diagnosis, management, and treatment associated with the neurological disorder are considered to be most challenging based on its integration of the complex nervous system. Assessment of the literature and medical record provides that the nervous system is vulnerable to about 600 diseases. Some of these diseases are dementia, Alzheimer, epilepsy, cerebrovascular. It also involves diseases like stroke, migraine, Parkinson's disease, multiple sclerosis, brain tumors, neuroinfection, and nervous system traumatic disorder such as autism and brain trauma. Though the conventional planar image continues to assess the clinical disorder, the advent of new diagnostic imaging such as computed tomography or CT, magnetic resonance imaging or MRI, and nuclear medicine or NM has served to be of great significance in contrast to the old technique. These technologies are based on 3D anatomical of the human body as well as their functional image. Reflecting upon the purpose of advanced technique, MRI is used for assessment of the cerebrovascular impairment and for eradicating the other prevalent causes of neurological disorder. Along with it, the use of computerized tomography, or we can call CT, is also frequently used with MRI based on the association of the two as the traditional technique for identification of the metastatic disease. Generally, MRI is considered to be more effective as compared to CT based on its integration of better resolution of the soft tissue, strength contrast enhancement, decreased bone artifact, and volume effect, partially and direct multiplanar imaging, which permit it to detect the smallest metastases upon scanning. However, the use of CT is considered to be prime when the stroke is to be diagnosed based on its better efficiency and practicality in contrast to MRI, which further enable it to detect the high sensitivity of intracranial hemorrhage or ICH. A cross-sectional retrospective study has been conducted to evaluate the brain stroke and neurological disorder using MRI and CT imaging among hospital patients. The study has been conducted from July 2017 to June 2018 in several hospitals. The data was gathered from the medical record, and detailed history of the patient was gathered pertaining to their age, gender, and reason of examination. Along with it, CT scan and MRI scan findings were evaluated. CT and MRI scanning of the patient were compared in both male and female for assessing the neurological disorder. The findings of the study revealed that the MRI scanning produced more effective outcome as compared to CT scanning. At this juncture, the study concluded that the use of MRI image technology is integral for assessing the neurological basis. It serves as a valuable source for advancing the current neurological understanding of the major diseases associated with the central nervous system. Additionally, it also aids medical professionals in devising tailored strategies for preventing image-driven disease. The present study also reports several limitations, such as included only 2 neuroimaging techniques, CT and MRI. Based on it, the study directs future studies to evaluate the neurological disorder using the advanced imaging techniques such as nuclear medicine imaging. Additionally, preventive strategies can also be assessed along with the practice which neurologists can adopt for providing quality neurological care. Alright, that was the delivery of the material about radiograph journal. Forgive me if there are many mistakes in the delivery of the material, and thank you for your attention. See you next time, and goodbye.